So I don't know why I did this to myself, but about a week ago, I rewatched Contagion. And judging by the way that it's topping lists on streaming services, a lot of you have probably done the same thing. And for those who haven't, Contagion is the 2011 Steven Soderbergh movie about a really deadly disease that becomes a pandemic and takes over the world.
Don't talk to anyone. Don't touch anyone. Stay away from other people.
We're not sick!
Contagion on its own is a terrifying movie. But watching it now in the middle of an ongoing pandemic really makes you wonder how bad things could actually get with this coronavirus.
It's spreading very rapidly because some countries are having trouble containing it. In countries where the response hasn't been as quick, they've really paid the price.
At the time it came out, Contagion was praised by scientists for its realistic depiction of what a pandemic would look like if the world wasn't ready for it. And we've already seen a lot of the plot points in the movie play out in real life. Today on the show, I'm talking to Tracey McNamara. She was a scientific advisor on Contagion, and she also discovered the West Nile virus in 1999. She has a lot to say on the similarities between Contagion and COVID-19 and how we can prevent the worst parts of the movie from happening. From Global News, I'm Tamara Khandaker, and you're listening to Wait, There's More. Hi, Tracey. Thanks so much for joining us today.
Oh, happy to do so.
So I recently rewatched Contagion, like I'm sure a lot of people who are listening to this did, because it's been all over the Netflix homepage. And I can quickly summarize the movie for people who have seen it but maybe can't remember it. So Contagion is the story of what happens when a highly contagious and deadly virus becomes a global pandemic.
So we have a virus with no treatment protocol and no vaccine at this time.
Gwyneth Paltrow is patient zero, and she brings the virus back to the U.S. from Hong Kong, and it starts spreading like wildfire.
On day one, there were 2 people, and then 4, and then 16. In 3 months, it's 1 billion. That's where we're headed.
And within a really short period of time, everything falls apart. People are looting stores and people's houses, stockpiling food. Government officials and health workers are trying to keep everyone calm and sort of failing at doing that. Jude Law plays a journalist who's peddling conspiracy theories about the government hiding some kind of cure.
They're calling out the National Guard. They're moving the president underground. People will panic.
Get away!
It will tip over.
The truth is being kept from the world.
And things only calm down after there's a vaccine and it's been widely distributed. But by the end of the movie, the disease has killed at least 26 million people. Did I miss anything?
No, that's pretty accurate. Although I think what people need to remember is at the very end of the film, this may have gone over a lot of people's heads because it was kind of quick, but you see a bulldozer knocking down forest in some country in Asia, and you see all these bats flying out of the trees and then going to where, like a pig farm. It's actually exactly what happened with the Nipah virus in Malaysia. And bats, where they lived in the forest, had been clear-cut. And so they flew to the nearest fruit trees. And the fruit trees happened to be on a farm where there were a lot of pigs.
Right. And a bat ate the fruit and then dropped a piece of it into the pig pen. A pig ate it. And then we see a chef cooking that pig. He puts his hand into its mouth, and then he shakes Gwyneth Paltrow's hand.
And the virus jumped from the bats to the pigs and then to people. So that was, in the movie, an extremely realistic depiction of how these viruses can jump. What it really came down to is revenge of the rainforest, as Richard Preston said in The Hot Zone. All of the recent emerging infectious diseases have been related to animals, to wildlife. And invariably, it's been due to human encroachment on their habitat. So we shouldn't lose sight of that. This particular outbreak, people are saying it's related to bats, possibly pangolins. That all remains to be seen. A lot of research to be done on the actual origin of this virus. But when we get through this storm, one of the lessons is we need to find some way to create that buffer zone between ourselves and animal reservoirs for these emerging infectious diseases.
How'd you get involved in Contagion?
I was asked to consult on the movie Contagion because I was involved in the discovery of the West Nile virus in 1999 when, again, a virus that had never before been seen in the Western Hemisphere popped up in wild crows, spilled over into captive zoo birds. Flamingos started dying.
At the time, Tracey was the head of pathology at the Bronx Zoo, and she says they started seeing wild crows falling from the sky into the animal exhibits. Tracey's job was to test anything on zoo grounds for diseases, and in the crows, she found that they had a really unusual, brand new form of encephalitis, which is inflammation of the brain. And at the same time, New York City announced that people were dying from an unusual form of encephalitis, and Tracey thought that there were too many similarities to ignore, and she called up the Centers for Disease Control.
And that's what it turned out to be, West Nile virus.
Okay, so you discovered the West Nile virus. And so when you got this call from Contagion, what did they tell you about what they wanted you to do? What was the movie that they wanted to make?
Well, they did something very smart. They reached out to scientists who had been involved with the West Nile outbreak. We had lived it. And they told us they wanted to make this a very accurate depiction of what could happen with one of these zoonotic disease outbreaks. They worked hard to capture the basic premise of how a virus can jump species, very accurately so. They captured how quickly a virus can be spread around the globe through touch, through contact, through aerosol, through droplet, very much like this virus that has swept around the globe.
When they asked you to come on to the project, did they talk about making this as realistic and as plausible as possible?
Yes, and they were trying to come up with a storyline that would ring true. The recent emerging infectious diseases that popped up in Australia was something called the Hendra virus, and it popped up in horses. And they were thinking, should we do that? I'm like, well, no, because now we have a vaccine in the horses, so that really wouldn't, no, I don't think that's a good one. So we explored, of what storylines, what would be plausible, as far as a storyline and a virus, jumping species. And I wasn't the only expert. If you go at the end of the film, there's a list of people who consulted on the film. And I was the only veterinarian, as far as I know. The rest were all public health, MD, researchers. But I think, with our input, they really pulled it off in the film.
So you mentioned consulting on story and rejecting this horse idea. But what exactly does a scientific advisor do on a movie?
Oh, you just talk to people. The scene where that scientist who's trying to create a vaccine.
If we even had a viable vaccine right now, we would still have to do human trials, and that would take weeks. And then train survivors to give inoculations, more months, more deaths.
And she's going to test it on herself. And in the scene, they wanted her to just stick her syringe with her vaccine through her blue jeans. Dr. Lipkin at Columbia University said, no, that would never happen. So those little things about, because people making films aren't in the medical field, they took the trouble to get those kind of details right. Kate Winslet in the film, who's the epidemiologist from the CDC, they definitely got scientific input on what an epidemiologist actually does. And everything she said about don't touch your face, the number of times a day a human being touches their face.
The average person touches their face 2,000 or 3,000 times a day.
2,000 or 3,000 times a day?
3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, elevator buttons, and each other.
What are we saying now? Keep your hands away from your face, your mucous membranes.
So watching this movie now, it's crazy how many of the plot points have already played out over the course of the last few months, like the way that the virus has spread, the spread of misinformation, the way that public health officials have been trying to keep everyone calm while also trying to navigate political responses from governments. Watching how this is playing out, are you also struck by the similarities between the movie and what's happening right now?
Oh, very much so. And I do hope some of the more frightening aspects of the film do not play out. with the civil unrest and food shortages and everything Matt Damon lived through in that film.
Is anyone even working here?
Just get the cereal. Jory, don't touch anything.
You will only be able to give out 50 doses today. That's our Forsythia 11. That's...
Hey, excuse me, there's a line here. Excuse me.
At this point, we're at war with an invisible enemy about which we know very little. The only thing scientists can tell the public at this point is, please cooperate with your health officials' recommendations. If schools need to be closed, if we need to quarantine, please cooperate. It's no longer about people's individual wants and needs. It's about the collective we. Think of it as an alien invasion. You know, we're human beings and we're fighting an enemy, and we need to pull together. There will be time for picking this apart and who did what and who didn't do what. And we're in the trenches, and people need to understand that they need to take some responsibility for protecting themselves as well.
Was Contagion meant to be a cautionary movie? Did you guys have conversations about making a movie that would serve as a sort of warning for the public about the possibility of a global pandemic?
Oh, yes. But, you know, it's the frustrating thing is these, novel viruses have been popping up and killing people for 20 years. Governments have been warned. We should have been better prepared. But there is this weird human psychological thing where people, just prefer to go into denial until it slaps them in the face, which is what has happened now. You saw it play out. Oh, it's just a flu. Oh, this is nothing to worry about. Oh, it'll just hit young people and old people. Same thing happened with West Nile virus, where public health agencies always are walking a fine line where they want to prevent public panic. People were told it's only the young and the very old. Well, what happened was everybody assumed, well, then I don't have anything to worry about. And a year later, the New York City Health Department had to admit that actually had not been the best tact to take, because no one wore mosquito repellent. No one took care of getting rid of mosquitoes in their backyards. You need careful messaging, but I hope people realize that being prepared is not at all the same thing as being panicked. It's simply being prepared. And actually, your panic level goes down when you know that you can hole up in place and that you'll be able to take care of, yourself and your family. You've done everything you can on your end to be prepared for whatever comes.
We'll be right back. So Contagion was made in 2011, and 9 years later, it's going viral again. It's at the top of the iTunes movie charts. It's one of the most popular movies on Amazon and Google Play. Netflix is promoting it. Why do you think people are watching it again? Also, do you think it's a good idea for people to watch it right now, given everything that's going on and, the fact that we're kind of living through this?
Well, it's very realistic. It is realistic. I think people are watching it because we're dealing with such uncertainty. They're trying to gaze into a crystal ball and see what may happen. But the truth of it is, none of us knows. We do not have enough information on this virus to know how many people will be affected. The most difficult thing about this virus is that people can be infected and be asymptomatic. And that's why I'm saying it's an invisible enemy.
What are the main differences that you'd highlight between Contagion and what's happening right now with the spread of COVID-19?
In the movie, they had already at the end sort of figured out where the virus came from and how it jumped species. We're still going to have to do research on that.
The death rate of the virus in the movie seems to be much higher.
Yeah, we don't know that yet. We don't know what the ultimate death rate is going to be. It's been very hard to get information, accurate information, and especially because when you're figuring out a case fatality rate, we don't have the denominator data. We don't know how many people are infected because we can't test. So that makes it difficult to really come up with those statistics. But we do know that, 20% of the people who get infected become critically ill. We do know that in China and other countries that they have been hospitalized for a lengthy period, 6 weeks, 8 weeks, and on ventilator support. What's going to happen here in the United States, we're deeply concerned about how this will impact and potentially overwhelm our health system. The only weapon we have is to stop this virus from spreading more than it already has. We need social distancing. That will buy us at least some time. Everyone needs to behave like a citizen of their country now. It's not about, their individual wants. It's about doing what's best for the collective whole. And we really need to protect our healthcare systems by minimizing spread of this virus to the best ability and decreasing the number of people who have to go to the emergency room. Some of the worst parts of the film haven't happened, but, they did call out the National Guard in New Rochelle, New York.
Governor Andrew Cuomo said the National Guard would deploy this week to deliver food and support to a 1-mile containment zone around the town of New Rochelle, which Cuomo called a, quote, hotspot for the coronavirus.
So day by day, it's becoming more and more similar to the film. Most of our drugs come from China. Will there be drug shortages? We don't know yet. All of our masks are produced in China. That's why there's a critical shortage. Costco and Target have been sold out of toilet paper and hand sanitizer for weeks. People have been hoarding supplies and masks, and the on the poster for the film it says nothing spreads faster than fear, and that's very, very true. So many of the things depicted in the film are already playing out.
I guess the other thing that stuck out to me is the lack of a vaccine and how long it took in the movie for them to figure out a vaccine, and then how long it took to distribute it widely, and only then did things sort of calm down.
Health officials have said you're not going to have a vaccine available to the public for at least 18 months. Vaccines have to be tested. You have to get FDA approval to be able to use them in the public. It's a lengthy process. And the other thing is, it's a coronavirus. Veterinarians have been dealing with coronaviruses for decades, and it's difficult to get a good vaccine against a coronavirus. So, I think, vaccinologists are going to they have their work cut out for them.
There is one plot point in the movie that I wanted to ask you about, and it's when Marion Cotillard's character, she plays someone who works for the WHO. She ends up getting kidnapped by the Chinese delegation because they want to use her as leverage to get the vaccine.
I need you to come with me.
What are you doing?
Please.
Go!
And so it kind of speaks to the inequalities that we could see at play here when the vaccine does finally get created. Do you predict something like that happening, like there being hierarchies in terms of who gets the vaccine first, who gets treatment first once that's sorted out?
I don't know. I know that in developing countries where many of these viruses have originated, and the West always wants the virus so they can create a vaccine, and the country from which the virus originated said, yeah, well, what about the vaccine for our population? And there have been problems with that. And I don't know that they've, come up with a solution. When you're talking about vaccines, the problem is there's a huge amount of money involved, a lot of profit to be made. And developing countries are saying you only are creating the vaccine because of the material we gave you. So it does become a diplomatic and cultural challenge.
Tracey, thanks so much. It was great talking to you.
Okay, thank you so much.
All right, that's the show. But before we go, if you haven't been paying attention since last night, there have been a whole bunch of new coronavirus-related developments that I'm going to catch you up on really quickly. Last night, Donald Trump announced that the U.S. is imposing limits on travel for most of Europe for 30 days for people who aren't U.S. citizens. The NBA has suspended its regular season, as have the NHL and Major League Soccer. We also heard that Tom Hanks and Rita Wilson have tested positive for the coronavirus, and they're in quarantine right now in Australia. And today, Prime Minister Justin Trudeau and his wife, Sophie, announced that they were putting themselves in isolation and getting tested for COVID-19.
Sophie Gregoire Trudeau was overseas in the UK. She had a speaking engagement there, and when she returned, she started to develop flu-like symptoms.
Sophie Gregoire's symptoms have since subsided, and they're currently waiting for their test results. Lastly, NDP leader Jagmeet Singh tweeted that he's not feeling well and that he's also in isolation. That's it for now. I'm Tamara Kandaker, and I'll talk to you tomorrow.